Autism spectrum disorder, ASD, is a broad term used to describe a group of neurodevelopmental disorders. These disorders are characterized by problems with communication and social interaction. People with ASD often demonstrate restricted, repetitive, and stereotyped interests or patterns of behavior. In today's video, we will learn about some important facts about autism. But there are still a lot of misconceptions about autism. Here, 9 things you may not know about autism spectrum disorders, including symptoms, how children are diagnosed, available treatments, and more. So let's get started. 1. Autism and its spread. More than 3.5 million adults and children in the United States have an autism spectrum disorder, ASD. That's 1 in every 68 births. More people have been diagnosed with autism spectrum disorders in recent years, according to data from the CDC. And with this increase has come more knowledge and awareness for the developmental disorder. 2. Children can be very young when they are diagnosed. It's possible for children as young as 18 months to be diagnosed with autism spectrum disorder. But most diagnoses occur at 24 months or older, at which point the diagnosis is considered to be very reliable. Before that, kids with autism will show deficits in social communication, but it's appropriate for their age. There is no medical or blood test for autism, so doctors typically evaluate a child's behavior through a developmental screening and then a comprehensive diagnostic evaluation, which can include hearing, vision, and neurological tests. The doctor may also recommend a follow-up visit to a specialist, such as a developmental pediatrician. 3. There is a wide range of symptoms. Symptoms of autism spectrum disorder can vary widely depending on the individual. For some people, symptoms of the disorder are mild, while they may be more pronounced in others. But symptoms of ASD generally tend to involve communication skills and social behaviors, such as being extremely introverted, not wanting to play with other children, or not making eye contact. Kids with autism spectrum disorder may repeat certain behaviors, such as flapping their hands over and over again, or they may become obsessed with a particular toy, like Thomas the Train. Lack of verbal skills is one of the most well-known symptoms. 20 to 30% of people with ASD are estimated to be nonverbal. 4. Prevalence seems to be growing. Stats on autism can vary, but the CDC estimates that about 1 in 68 children in the United States had an autism spectrum. There is a lot of disagreement among experts about whether or not this increase reflects more people actually having an autism spectrum disorder or more diagnoses due to increased awareness and screenings. In other words, more research is needed to determine what exactly is behind these figures. 5. Boys are more likely to be diagnosed. Autism spectrum disorders are about 4.5 times more common in boys than girls, but it's a stereotype that all autistic people are white men. People of all races and ethnicities can be diagnosed with an autism spectrum disorder. And although boys do tend to be diagnosed earlier and more often than girls, there is growing evidence that the number of ASD cases in girls is underdiagnosed. 6. Autism may begin before birth. Scientists don't know exactly what causes autism. Most experts agree that a combination of genetic and environmental factors increase a child's risk of developing an autism spectrum disorder, but there are still a lot of unknowns. There is emerging evidence that children may start to develop autism before they are born. We know it's pre-birth because we have identified cells in brains of people with autism that are different. 7. Children with autism are more likely to have other health conditions. People with autism spectrum disorders have a greater risk of other health conditions as well. About 2% of people with ASD have Fragile X syndrome, a genetic disorder that causes intellectual disability, and as many as 39% of autistic people have epilepsy by the time they are adults. What's more, people with ASD may also be more prone to anxiety, ADHD, depression, sleeping problems, allergies, and stomach issues. 8. Vaccines do not cause autism. Although there continues to be a lot of disagreement about the link between childhood vaccinations and autism, it's been determined to be a myth by study after study. Vaccines are not one of the causes. The theory first began after a small 1998 study claimed to find a link between the measles, mumps, and rubella (MMR) vaccine and autism. 9. Early intervention is key. There is no cure for autism, but early intervention may help autistic kids thrive. It works by identifying the reasons why kids are engaging in behaviors. For example, activities like throwing tantrums and flapping hands are often triggered by the frustration of not being able to express that you are hungry. There are also medications available to help manage some of the symptoms of ASD, such as antidepressants, anti-seizure medication, or medications to help difficulty focusing. Bonus fact: evaluations and interventions may be free. Think your child might have an autism spectrum disorder? You can request a free evaluation from the public early childhood system in your state. There is currently no cure for ASD. Early intervention services help children from birth to 3 years old. Services can include therapy to help the child talk, walk, and interact with others. Therefore, it is important to talk to your child's doctor as soon as possible if you think your child has ASD or other developmental problem. So hope this video provided some important information and was valuable to you. If you find this video valuable, share it with your friends, show us some love, do subscribe our channel, and don't forget to push the notification bell. Catch you up in another mind-bending video.